Over just a few days, a meningitis outbreak at a university campus in Canterbury expanded to 20 cases and 2 deaths. When an infection moves that fast, the immediate reflex is to fear a rapid airborne pathogen. Following the years of the COVID-19 pandemic, it is natural to imagine a disease spreading through casual contact on trains and buses. This data visualization shows the divergence in transmission rates. While COVID-19 has an R0 of around 8, meningitis remains close to 1. The R0 is an epidemiological metric indicating the average number of people one infected person will pass a disease to. Because this value is so low, the bacteria does not spread through casual environments. It requires the intimate contact of shared drinks or kissing. Despite that limited transmission, this specific cluster expanded to 20 cases within a single week among a concentrated group of young adults. The Canterbury cases represent a targeted strike that successfully exploited a specific epidemiological vacuum. The culprit is a bacterium called Neisseria meningitis. Up to 1 in 5 adolescents carry these bacteria harmlessly in the back of their throats, acting as a natural reservoir for the disease. This anatomical cross-section tracks the infection as the bacteria migrate from the nasopharynx through the cribriform plate. The cribriform plate is a bone at the base of the skull with tiny perforations for nerves. Once through, the bacteria inflame the meninges, the 3 protective layers wrapping the brain and spinal cord, known as the dura mater, arachnoid mater, and pia mater. Alternatively, the bacteria can bypass the central nervous system and enter the bloodstream directly, causing a systemic infection known as meningococcal sepsis. Before a visible rash appears, victims experience a classic triad of symptoms: a sudden fever, a crushing headache, and severe neck stiffness. This is often accompanied by photophobia, which is a painful physical sensitivity to bright light. If sepsis develops, patients often present with a non-fading rash. These marks are actual hemorrhages, where blood is bleeding directly into the surrounding tissues. Because the blood is no longer inside the vessels, the rash does not turn white when pressed with a glass. Because the bacteria can cause meningitis, sepsis, or both, the rash does not appear in every case. Waiting for a visible mark to appear before seeking help is often a fatal error. First-year university students engage in the specific social behaviors required for this transmission. Shared drinks, cramped dormitories, and kissing allow the bacteria to jump from a carrier to a new host. This high-risk behavior is compounded by a specific gap in the UK's meningococcal B vaccine rollout. This timeline tracks the NHS vaccine schedule, showing that the Men-B vaccination program was only introduced for infants in 2015. This means anyone currently over the age of 10 was born too early to receive this routine immunization. This historical gap leaves the current group of young adults immunologically naive. Their immune systems have no pre-programmed defenses against this specific aggressive strain. The outbreak followed a predictable pattern, where close-quarters social behavior collided with a generation-wide lack of herd immunity. To contain the Kent cluster, health authorities administered post-exposure prophylaxis to close contacts. Post-exposure prophylaxis is a preventative course of antibiotics, such as penicillin, given to people who have been exposed to an infection to stop the disease from developing. For active cases, rapid intravenous antibiotics are effective at preventing death and permanent disability, provided they are administered immediately upon arrival at a hospital. Outside of these localized clusters, the statistical threat to the general public remains low, with roughly 1 to 2 cases per 100,000 people each year. However, the individual risk remains extreme. A patient can deteriorate from mild symptoms to death in under 24 hours. Surviving meningitis B requires extreme social vigilance, checking on friends who feel unwell, and acting within minutes, not hours, when the classic triad of symptoms appears.